The issue around World AIDS Day. Now, as the world marks AIDS Day, inequality has unfortunately come into sharp focus, and with the discovery of a new variant, it appears as if the fight against HIV/AIDS may be taking the backseat. And despite the progress that has been made against HIV, there are 37 million people in the world still living with this disease. In addition, 680,000 people died last year from AIDS-related causes. Now, let's look at how inequality drives HIV among adolescent girls and young women. We are speaking to Dr. Hilton Humphries, who's a behavioural scientist. Dr. Humphries, good evening to you, and thank you so much for your time. One of the most disturbing statistics that we saw coming out in September was the Department of Basic Education telling Parliament, in fact, that, there's about 1,300 adolescent girls and young women who are being infected with HIV in the country every week. As we reflect on this day, 40 years on since the first patients were detected, should we pay a special focus as the world towards this particular growing statistic?
Yeah, thank you very much. It's a pleasure to be with you today and this afternoon. And there's no better theme for World AIDS Day this year than inequalities. If we're looking at young girls, if we think about the statistics from the Department of Education, I mean, what we know from research is that young girls who are in school are, at lower risk of HIV infection than those who drop out or those who aren't in school. So when we're thinking about that situation already in schools, what is the situation for those that don't have access to education, who have dropped out because of early or unintended pregnancies? And so this refocusing on understanding the nuances of risk, focusing on young women, looking at gender inequalities, economic inequalities, and educational inequalities is key to targeting our HIV interventions as we move forward.
And would you say that the factors that you've just listed now are the only factors that make these young girls and young women more vulnerable?
Well, I think there's a combination of factors, and I think that's where the complexity comes in, is that we've got a host of biological factors that increase the risk of young women to HIV infection, but that sits and is located within their social context. So the HIV risks is this synergy of factors from the biological, from the socio-behavioral and structural factors. But we know that female poverty is a risk factor for HIV. We know that a lot of women are still dependent on their partners for economic survival. And those are drivers of the HIV epidemic. I mean, even if we look at the HIV transmission cycle, we know that young women are getting infected by men who are older than them. And a lot of those relationships are sustained by the economic and social power that those relationships provide.
I wonder then, how do we begin to characterize those particular relationships? And I put it in inverted commas because there's a lot of talk around the characterization and thus leading to the appropriate steps that need to be taken, in fact, to deal with this. Should we not call it what it is? Because that's statutory rape in some instances, because you look at some of these girls between the ages of 10 and 14 falling pregnant, a girl as young as 10, surely that we need to start characterizing differently.
So, I mean, those instances of, statutory rape, exploitative sex are really critical issues. They're unacceptable, and we should, we have policies and laws to enforce, action against those. But what's also important to remember is that we exist in a situation where relationships often offer a lot of economic and social power. They provide the means for people to survive. And so an intervention, to take a hard line against exploitative sex, of course, but then also think about how do we bring men into our HIV response? How do we start interventions with young men to say, how do you engage in relationships? How do you treat women? How do you gender equity, gender equality. It's about thinking about the dyadic level, those relationships as well as the individuals.
And Dr. Humphries, one of the things, that came out today was the Gauteng Premier David Makhura talking about parents needing to, hang their heads in shame, essentially. And because there's also that particular contributing factor, but he also admits that there's a myriad of other issues that contribute to this problem that we have. Let's look at the practical steps that now can be taken in order to speak to a young woman that you've just described, who is not going to have something to eat tonight and is thinking that they're going to have to, go to a man and be exploited in order to put food on the table for some of their siblings, because we do have child-headed households. How does government begin then at a practical level to address some of these concerns?
Yeah, and I think it's about building a protective environment. We need societies that are resilient, right? And the COVID epidemic has taught us that as well, that we need to have resilient societies that can, weather the storm of disarray and, of upheaval. And I think some of the key issues is to think about the long-term game and the short-term game. In the short term, how do we provide social protection programs that can help girls to, they can feed girls, they can keep girls in school, because we know education is critical to addressing gender-based violence issues as well as supporting future economic independence. So that's those are the long-term goals, are to keep them in school, to economically empower them so that they can, they can be the authors of their own futures. In the short term, it's thinking about how do we put in place social protection programs that can keep young women fed and in school, but also then thinking about how do we achieve social change. So how do we use communities to talk about the change that they want? How do we help people and empower people to be agents of change? And I think those interventions need to work together to support one another.
Dr. Humphries, thank you so much for your time this evening. This is one of those conversations that really we need to explore further, especially during a pandemic like we are in.